Thank you, Representative Leonard, Senator Bray, and all the committee members for the opportunity to speak today. My name is Dr. Emily Scott, and I'm a pediatrician here in Indianapolis. I'm here today representing the Indiana chapter of the American Academy of Pediatrics, which is an organization that represents over 700 pediatricians throughout the state of Indiana. I'm currently serving as president of Indiana chapter of the AAP. As my OBGYN colleagues just informed us, the COVID-19 vaccine is safe and effective for individuals who are pregnant and those who hope to become pregnant in the future. I am here today to speak to the impact of COVID-19 vaccine on babies. When a pregnant person contracts COVID-19, they are at high risk for severe illness. As my OB colleagues have already stated, we've seen firsthand the devastation of pregnant individuals dying of COVID in our state. What we don't talk about often is how this impacts their infants. When a person is seriously ill with COVID, their babies are often delivered prematurely. Premature birth is one of the greatest risk factors for infant mortality, which is something that our state already struggles with. When a baby is born early, they are likely to spend months in the neonatal intensive care unit before they're able to go home. During that time, they will require machines to help them breathe and to grow. And when they go home from the NICU, premature babies are more likely to have long-term health problems, like problems breathing, kidney disease, cerebral palsy, delays in development, among other complications. Vaccinating a pregnant person for COVID-19 helps prevent serious disease in both that individual and their baby, both in the short term and the long term. Not only is COVID-19 vaccine safe for individuals to get during their pregnancy, it actually may help prevent infection in their baby. When people get a COVID-19 vaccine during their pregnancy, their body builds up antibodies to COVID. These antibodies have been shown to pass through the umbilical cord to their baby, which may help protect their baby from getting COVID-19 in the first months of life. This is when babies are especially susceptible to getting an illness. It's also safe for breastfeeding individuals to receive the COVID-19 vaccine, and they can pass antibodies onto their babies that are too young to get vaccinated. To continue to support the health of pregnant people and infants in the state of Indiana, which has always been such a priority of this body, Indiana AAP asks that the language referencing pregnancy or anticipated pregnancy be removed from the proposed medical exemption. Thank you.
Questions from committee? Representative Austin.
Thank you, Mr. Chairman. Dr. Scott, would a nursing mother who has received the vaccine transfer any of the antibodies to her infant through the nursing process? Yes.
So if a breastfeeding mother has received the vaccine, she'll pass those antibodies to her child, just like with other vaccines or other illnesses.
Is it enough to help protect the infant? Do we know?
We don't definitively know that. We can extrapolate from other disease processes and know that that does help, but we don't have that data specifically for COVID-19 yet.
Okay, thank you.
Any other questions?
We've got one more follow-up.
Representative Austin.
Thank you. Have there been infants that have presented with COVID-19?
Yes. To the hospital? Yes.
And how do you treat them? What do you do?
So there's no current treatment except for supportive care. So we admit them to the hospital or we provide care to them in their home, kind of depending on how ill the baby is.
Outcome? Is there any, have you got any data on outcomes?
I can get that for you. Specifically, the AAP has gathered that data nationwide. I don't have specific data for here in Indiana.
Okay, thank you.
You're welcome.
Other questions? Thank you, Dr. Scott, for your testimony.